Mark Jacobs. I work for Leighton Contractors mining division in Queensland. I look after a small part of pre-employment and the injury management process. We work in mines in Queensland and New South Wales, so basically stripping off the overburden and in some situations also doing the coal mining. We've aligned our strategic objectives basically to be in line with our risk-based approach in our business. By doing proactive injury management, it assists us in lowering our TRIFR rate. There's one case that comes to mind where we've been able to demonstrate a commitment to return to work. This gentleman had a serious injury to his shoulder. He is an older gentleman in our workforce. Arranged for him to come straight to Brisbane to be seen by one of the top specialists in Queensland. We were then able to arrange that afternoon to have him straight in for surgery. All the time this was happening, we were discussing with the workplace, with the worker and with work cover, where this gentleman started to become extremely depressed with his condition, thinking that he would never be returning to work, thinking basically that his life was coming to an end. We were able to bring people down from the mine site to catch up with this person while he was in hospital, and then when he was back at home. We were also able to arrange home visits from the office with some of our operations managers. His rehabilitation was fast-tracked and he actually returned to work 3 months early. It's very much about what the person can do, not what they can't do. The physical demands assessments or physical task assessments are information that's been gathered on every single job that we conduct on the mine site and also in the head office in Brisbane. We will talk to the doctor before they go in for the surgery with the worker, and we will already map out a return to work program. Our people are the foundation of our success, so it's very important that we also carry that to the family model as well. We go above and beyond in supporting people with emotional and physical side of things in relation to an injury. The emotional side of things we assist in are things such as childcare, lawn mowing, helping pick up children, flying people where they need to go to be with their loved ones if they have been injured, psychological support, adjustment to injury counselling. We have been able to align a lot of the physical rehabilitation back on sites using the gyms provided by the clients. We're very open and approachable when it comes to injury management. Leighton Mining are very proud and honoured to be recognised for this award. People are very comfortable to come and talk to the rehabilitation return to work coordinators on site, not only in relation to their injuries, but also in relation to domestic injuries or illnesses, which is a very satisfying thing to hear because it goes to show that we do have a very empathetic and understanding culture in our injury management and rehabilitation section.